Hello, hello. This is Dr. Geo, and today I want to talk about gum health. This also actually just came up very recently. I saw a couple of patients that we had to have just a nice conversation on what's going on with the gums and bones. And that's one of my primary focuses on when I see a new patient or when I see someone new, or just yearly checkups to make sure that the foundation or what's holding up the teeth is nice, strong, and healthy, because that's the only thing holding up the teeth. And if that's not good, then the foundation on the house is not doing too good and it might crumble. And so I like to explain gum health in kind of a spectrum. And so there's three stages. There's one stage that's healthy, everything's nice, fresh, strong, no bleeding, no issues with the bones. And so that's healthy gums, right? On the opposite end, we have something a lot more complex, and it's associated with a lot of different factors. There's some medicines that impacted, there's some health that impacted, like diabetes, there's some other factors like smoking that really impacted. And so, what gum disease is, also known as periodontitis, is a chronic inflammation of the gums where they're just swollen and bleeding, and sometimes they don't bleed, but it's so irritated that it starts affecting the bone. So once the bacteria irritate the gums and get to the stage of the bone, then the bone just gets weak and starts loosening. And so when the bone and the foundations gets loose, we have some loose teeth, or we have lots of shrinkage of the gums, and you kind of see a lot longer teeth. And sometimes they also change color. They're not really changing color, but you see the root of the tooth, which is more yellow brown, and so that's where something like whitening isn't really going to help. And so, to that extent of a disease, it's not fun to deal with, and there's no cure for it, but we can manage it, maintain it, and keep it from getting worse. But we don't just jump to gum disease. We can always try to keep you healthy. And there's something right in the middle that's called gingivitis. And what gingivitis simply is the gums are a little bit swollen, sometimes in one area of the mouth, sometimes everywhere. But when the gums are bleeding, that's usually your body just telling you, hey, something's going on. And so with gingivitis, it's really easy to get you over here, get you nice and healthy. But if we stay with gingivitis for a long, long, long time, and sometimes that length of time is different per person, so it could happen sooner rather than later, we can kind of sway over to the infected side, which isn't fun to deal with, but it's still manageable. And so that's kind of my way of talking about gum health and gum disease. And so if you have any questions about that, feel free to let me know. Call me and I'll personally be able to answer those questions. If you find something like this beneficial to your friends or family member, feel free to share it, and feel free to subscribe if this is something you're interested in. See you guys next time. Ciao for now.